got it. We're good there. All right. I think we're good there. We have got her. Maybe, maybe not. Sweet. YouTube, we are now live. What is going on, you beautiful people? Welcome back to another Wednesday Q&A. What's up, Liz? We're 3 for 3 now, me showing up. Fortunately, I got like a wicked night's sleep last night, so I'm relatively energized. I know last time, like towards the end of the hour, I was feeling it. I was tired. You guys asked really good and awesome questions. So look at all these things on TikTok. Subscription goal, add a live goal. I'm going to have to look into all of that. But what's going on, people? Awesome. Thanks, Liz. I appreciate it. Dun, dun, dun. Okay. I think we're good to go and functioning. So it's a new low when an obesity expert invites you to a live. I'm not sure what that means. Did I invite people? I don't understand that question. But do you love the snow and cold ass weather? I sure don't. Good old Calgary is doing the good stuff, you know, like it's been special. It hasn't been as bad as like I guess some of the snowfalls, because I have had to do a little bit of driving, so it's been more than manageable and stuff like that. But overall, yeah, it hasn't been too terrible. I've also been just like hiding in my condo and stuff, so that's kind of what we've been doing there. Young, lean, time to shave your head. It's on the list of things to do. We're holding on for as long as possible with this receding hairline. It'll last out for a little bit longer, and we'll see what things look like in a couple of years. So St. Albert here. Well, welcome from St. Albert, Trudy Hendry. And yes, it is. And it's supposed to get up to like +2 or 3 or something like that. So Stephanie Land on YouTube. What do you think about stacking different meds? Specifically for me, Saxenda and Vyvanse. I also have ADHD, so Vyvanse would do double duty for me. I mean, it really all depends, right? So if we're talking about stacking medications because we have multiple conditions, like we're, say, treating depression and we add on bupropion, which is a component of Contrave, and we, are on Saxenda or Ozempic already, or in your situation where you're on Saxenda, we add on Vyvanse, but they're kind of treating 2 different conditions, although Vyvanse can be used for binge eating disorder and certainly can have an appetite regulating effect. I mean, we're definitely treating separate conditions, and there's absolutely nothing wrong with that whatsoever. That's awesome and fantastic, and it's a matter of treating both of those conditions because, yes, they're interconnected and certainly can have an effect on each other. Having proper management of both is going to make the overall management of your general health that much easier. In terms of stacking medications for like weight loss medications, I have been struggling with this topic for a couple of reasons. First and foremost, we don't have much data of, say, taking Saxenda, Wegovy, Mounjaro, whatever like that, and then adding something like Contrave or whatever, and just using it purely for weight loss. So looking at it in the sense of Saxenda, we got a certain amount of weight loss. We're going to add on this other drug to get more weight loss. So we don't have a heck of a lot of data to say, A, safety-wise, B, effectiveness, and if it's actually going to do anything in that respect of things. So that's one aspect. The second aspect is that, as I always say, these drugs are nothing special, right? They're not increasing how many calories you're burning. They're not, affecting that metabolic rate in any kind of way. What essentially they are doing is they're just making it easier for you to reduce your calories that are going in, and making that process a little bit easier for you so that your calories in can be less than your calories out. So if you're no longer losing weight, what's happening there is that we've reached this point where essentially your calories in, calories out on a day-to-day, week-to-week basis and stuff like that are equal. And so until we get you into a calorie deficit again, you're not going to lose further weight. And adding on a medication that's just going to reduce your appetite and reduce your hunger, yes, may ultimately lead to further weight loss because your appetite and hunger are reduced, you're going to eat less. But if you're already eating such a low amount that you're starting to notice the hunger signals and appetite coming back, basically it's going to be very temporary, because eventually the biology of your body are going to take over and say, hey, we've been trying to tell you and send out the normal signals to say, we're hungry, we need you to eat, we need some nutrients, but those signals weren't getting through. So we've made them more and more powerful for you. And eventually it'll make it so powerful that it overpowers that medication, and that medication will no longer be really working or effective for you, or feel like it's not effective, if you will. And so, yeah, we could stack on another medication that'll further dampen that down, but that biology will eventually ramp that signal up even further. And eventually, again, you'll start to notice that your hunger, your appetite and stuff are coming back, and perhaps you're starting to gain weight. And really what we should be looking at is actually treating that underlying biology, managing it, and getting you to properly give your body proper nutrients, increasing and maybe going up to your maintenance level of calories for a little bit and holding there, basically giving your body what it's asking for a duration of time, and not just like a day or a week. We're talking like a couple of weeks, a couple of months, and taking essentially a diet break to allow things to kind of come back around and re-regulate itself, and then trying to create a calorie deficit there afterwards. So that's one of the aspects of, stacking on a medication I see potential issues with, because we're not really looking at kind of the underlying issues and problems. We're just kind of adding things on and stacking things on. And ultimately, we're going to run into the same problem again at some point. So that is kind of, some of my qualms and I guess issues that I'm having with stacking weight loss medications. Further, a lot of people are being put on these medications and not being properly monitored, not being provided the proper amount of education. And so, without that proper education and stuff like that, we're kind of doing a bit of a disservice, because again, we need to look at the whole picture of an individual, not just add on a medication and tell you to eat less. All right. Morning, Bill. Wow. All right. I like all of the Alberta peeps. El Paso, awesome. Much, much warmer there, I bet. Bring on the migraines. Yeah, that sounds about right. So I'm recently diagnosed type 2 diabetic and prescription for metformin. I'd like to try adding Ozempic. My benefits require me to meet criteria. What kind of criteria would that be in your opinion? So Ozempic and Wegovy have the same molecule, right? I've got an Ozempic pen here that I twiddle in my hands. So they both have semaglutide. Ozempic only has the indication for diabetes management, whereas Wegovy has the indication for obesity management. So if you have diabetes, most drug plans and insurance providers are asking for extra documentation, special authorization forms, criteria, whatever, to be filled out in order to get coverage for this medication. So in your situation with regards to diabetes, what I know is usually you have to kind of go through a bit of a stepwise process. So first off, the first line for anybody that has diabetes is generally we add on metformin. That's kind of our first line agent. And then insurance companies generally want us to go to a second line agent called gliclazide, glyburide. They fall under a class of medications called sulfonylureas. Now, these medications, they are effective at lowering blood sugars, but they really have no other benefits other than bringing that blood sugar level down. I'm not a huge fan of them because they can cause things like hypoglycemia and potentially cause weight gain in some people. So they're not necessarily ideal from that perspective, especially if you're looking at weight management, excuse me, as one of your goals. But some insurance companies may require you to be on that medication for a period of time and either fail on that medication or continue on it, and then you can add on Ozempic. So that's kind of the general process for people to, or the special auth process and stuff like that you have to go through. And generally your doctor or your pharmacist can fill out that special auth form and help you to get on one of these medications, depending on your situation and stuff. So that's kind of that. It depends on the insurance company though. Some of them don't require this stepwise process. Some of them just need the doctor to sign off and say, yes, give a check mark that the person does have diabetes. This drug is indicated, blah, 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 blah. So that's kind of some of the aspects there. But it's going to vary plan to plan. I know, like say here in Alberta, we have Alberta Blue Cross, and they've got these special hoops that you need to jump through, but other plans are a little bit more lenient and stuff. So it all really depends plan to plan. So Trudy, I've been on Saxenda for 20 days, not many side effects, down 13 pounds so far, eating around 800 to 1200 calories. Okay. I mean, that's awesome. That's fantastic. It's working for you and you're not having side effects. 20 days and 13 pounds. It's a lot of weight very quickly. And 800 to 1200 calories. I would definitely be looking at making sure you're getting enough protein. Number one priority, and also potentially, more than likely, I'm willing to bet you probably need more calories than that. Yes, you would lose weight more slowly, but ultimately it's going to be a lot more sustainable, and it's going to help you to manage your overall biology and keeping your appetite and hunger better regulated and stuff for you. So that would be some of the things I'd look at there. Lorna Alicia, hi, what are your thoughts on Ozempic and the side effects? So Ozempic, very effective medication, semaglutide, the molecule, very, very good at helping to manage blood sugars, but also helping to manage weight. It has two of those huge benefits overall. So it's an effective drug, especially Wegovy at the higher doses. We do see significantly more weight loss. I think it was 1/3 of individuals lost 15% or more of their weight from baseline after about a year of being on Wegovy at 2.4 milligrams. Which again is Ozempic. So it's very effective. Side effect wise, if we were to say compare it to Saxenda or Trulicity or other GLP-1 receptor agonists, it definitely has more side effects that can occur. Most of the side effects that we see are primarily GI in nature. So biggest one is nausea. Some people get constipation, some people get diarrhea. Basically, it's because it's kind of slowing down your gastrointestinal, so how quickly food moves from like your stomach to your small intestine, but it's generally slowing down that entire pipe and system overall. And so, there's a lot of things that we need to think about in that respect, and we can mitigate and manage those side effects for most people with like small, frequent meals, bland meals, trying to avoid spices or anything that triggers or causes nausea. Trying not to go to bed right after eating a meal, kind of having yourself about an hour at least break and stuff like that. So those are all different things that can be used to mitigate. And eventually those side effects will go away as soon as your body's used to it. Now, in saying that, there's always an asterisk, if you will. Not everybody is going to notice the side effects going away, and some people might note that the side effects continue for indefinitely and they ultimately need to come off the medication. So varies person to person, but for the most part, the side effects are non-issue and stuff for most people. So Humblebee, how effective is Trulicity? I mean, it's effective. There's nothing wrong with it. Again, it's not as effective as Ozempic and Trulicity. On my YouTube channel, I reviewed one of the studies where they did a head-to-head comparison of Ozempic and Trulicity, and they showed that Ozempic was certainly more potent and led to a great amount of weight loss compared to Trulicity. Higher doses of Trulicity can certainly help more, but yeah, Trulicity just doesn't have the same potency as Ozempic. And a big part is that it's a little bit of a different molecule, and it's not a different molecule. It's still the GLP-1 agonist. So it looks like the GLP-1 hormone that our body naturally produces, but it's slight differences in terms of what it's bound to and how it all works and stuff like that. And it's a whole bunch of kinetic stuff that I don't really remember from pharmacy school. So and on YouTube, how much of daily caloric intake should come from protein? So it's really going to vary person to person. Anywhere from 20 to 30% of your total calories should be made up of your protein intake is my general recommendation. And if you're trying to lose weight, I generally recommend even going hot or up to the upper limit of like 30%. That's usually kind of your best bet of your total calorie intake. What that's going to do, I mean, protein is so vitally important because your body can't store it. You need to continuously take it in throughout the day. You need those amino acids. Your body needs to need that for muscle protein synthesis in order to preserve your lean muscle tissue, as well for general energy and just general function. Protein can be broken down and made into carbs. It can be broken down and made into fats. Protein is kind of like the king of the macronutrients. So 30% is generally what I recommend as part of your caloric intake. So yeah, that's kind of what I recommend there. Hot Mess Jen, can someone who had gastric bypass in 2008 use Ozempic after gaining weight back? Yeah, there's no problem with that. Obviously, talking to your doctor and stuff like that and just making sure there's no underlying issues or complications or anything like that, but there's certainly no issue. I've had plenty of patients and clients that I've worked with who have had either gastric bypass or the Roux-en-Y or whatever, and then we add this medication on later on after they've had some weight regain or something like that. Again, it comes down to like just making sure you're able to eat enough food and get enough protein and that sort of thing, which can already be challenging with a gastric bypass. But yeah, as long as you're kind of meeting your nutritional requirements and stuff like that, and continue to meet your nutritional requirements while you're on medication, no problems, no worries. Hello from Queensland, Australia. What's going on there, Queensland? I'm hoping to go to Australia here, maybe at the end of this year, if not early next year. My flight actually just got canceled, so I'm toying with some plans and have some other stuff that I'm working on and whatnot, and we might need to change some plans up, but we'll ultimately see. I want to go surfing in Australia. Mabel, loved Ozempic, awesome. Jason Cartman, how do you feel of Ozempic being so popular compared to gastric bypass? So, I mean, I am in big favor of if we can make medications that can ultimately lead to the kind of weight loss results that we see with gastric bypass. I mean, I'm all for it. Anytime that we don't have to physically cut your human body and cut out and take components and parts out, totally, I'm on board for it, right? That reduces your risk. Like, yes, there is side effects and stuff that can come with these medications, but yeah, if we can avoid doing a surgery and cutting you and stuff like that, all the better. Like, we have, this probably isn't the best comparison, but take like orthopedic surgeries, for example. Like, we're finding more and more of doing, like, say, ACL repairs or MCL repairs and like various joint bone repairs and stuff like that have been commonly done by orthopedic surgeons. We're finding that the surgeries don't actually do anything. In fact, sometimes they lead to worse outcomes. And so, I'm not saying that gastric bypass doesn't have good outcomes and stuff like that, but if we can just avoid doing surgery and doing more things either with medication or with other therapies and stuff like that, I'm always going to be in favor of that overall. Yeah, and that just kind of some of the stuff around in terms of like, the diet before and after and all that kind of stuff. Like, there's some things we need to worry about, malnutrition, other side effects that can occur. And it can sometimes be a little bit more challenging to mitigate and manage overall. So medication wise, if we can get the kind of results, fantastic, awesome. Some people will still ultimately need gastric bypass or some kind of surgery. Unfortunately, that's just kind of the reality of obesity and being a chronic disease. But if we can do it with medication, awesome. My doctor won't even listen to my weight concerns, told me to join Weight Watchers and try harder. Wow, that's a load of horse shit. I'm very sorry you had to go through that. unfortunately, yeah, there's a lot of docs out there. It's getting better, but a lot of them, they just have no clue. And it's very unfortunate too, because I know a lot of clinicians and physicians and stuff like that who I've seen them and I've heard them shame patients and whatnot, and then they engage in horrible health behaviors. And it's like, you got no leg to stand on, kind of thing. So it's really disappointing to hear things like that. Belinda, thank you. My pleasure. Trudy, I'm so full though. I'm not hungry. So, I mean, it's always challenging, definitely, because the medication can reduce your appetite and stuff like that. But yeah, just continuing to be mindful and seeing how you can slowly increase your food intake. And eventually, again, the medication will feel like your appetite is increasing or coming back. And that's a pretty good indication that, yeah, you want to definitely start increasing how much food you're eating and taking in. Can someone who had gastric bypass in 2008 start using Ozempic? Lorna, I've gained so much weight with paroxetine, diagnosed with anxiety and depression. Yeah, paroxetine, yeah, certainly has some weight promoting effects. I mean, in fact, it's one of the medications that will, when we have patients that say have problems with eating and they have comorbid anxiety and depression, we'll look at paroxetine as an option, and certainly can promote at least increasing appetite, ultimately leading to weight gain. And then you couple that with mood disorders and stuff. It's yeah, it causes some other issues and stuff like that. It makes it challenging, but there are other agents to potentially look at, particularly a lot of newer agents that people can be switched over to that are much less weight promoting, and may actually may lead to weight loss. Amanda, Ozempic made me so bloated with a lot of gas, had to go to the hospital 2 times, had to stop it. I'm so sad. My tummy was like a monster on it. Yeah, I've definitely, I've had some patients who had that unfortunate reaction. Some people just aren't able to tolerate it, and the slowing of gastric emptying is just too great. Some cases, there's things that we can sometimes do, like increasing fiber intake, increasing water intake, and increasing activity, and kind of helping things to move along. But other people, there's just sometimes nothing that can be done for it. And yeah, so there are other agents out there to try and stuff like that, and certainly might be a better option, better fit for you. Joyful Joy, can one go off of Ozempic for a little bit to restart again and to boost the weight loss? So going off of Ozempic or going off of Saxenda or anything like that isn't going to boost the weight loss or increase the rate of weight loss or anything like that. The only reason why it would is because you would come off of the medication, ultimately your appetite and everything like that would come back. You would overeat and overconsume, gain and put on weight, and then you would probably lose that weight relatively quickly going back on it. But it's not going to kickstart it or kick it back in. You're better to take a break from your diet and what you're eating versus taking a break from the medication. So again, increasing your calories up to your maintenance level, increasing your protein intake, focusing on health, building muscle, that sort of thing. All of those things are going to be better for you and probably lead to better long-term results, and certainly better long-term sustainability and stuff. To calculate like your maintenance level of calories and how much protein you need, I actually have I have a calculator. The link is in my bio and stuff, or you can go to my website, healthevolve.co/TDE calculator, or if you just type in healthevolve.co/TDE, the calculator come up. And if you punch in improved health, you'll be able to calculate out your maintenance level of calories. Been on it for a year and haven't lost any weight. So I always kind of ask, what do you mean by not losing any weight? A lot of people say, well, it's the same 5 to 6 pounds. Okay, so what does that look like? And also, what is our expectation in terms of weight loss, and where we're kind of, say, throwing up our hands and saying it's not working and I give up on the diet for this week or what have you. So one thing that a lot of individuals I work with, they'll have a gain and a loss of, like, say 5 or 6 pounds, but either the loss won't be happening quickly enough and it's 5 pounds down, but they're like, not happening quickly enough, or I need to lose a pound a week, or I need to lose 10 pounds in the same time, or whatever. And so they ultimately give up, and the all or nothing mentality kicks in, and then they go and overeat and overconsume and gain the 5 pounds back. Or simply they're just not consistent long enough, and they don't see results in week 1, week 2, or maybe they see a pound or 2 come down, but the expectation as to what we're considering a loss is just not there. And so a lot of people will also say, well, my weight has stayed exactly the same. And it's like, it's impossible for your weight to stay exactly the same. There's going to be day-to-day differentiations. There's going to be a pound or 2, 3 or 4 pounds, that sort of thing that's going to adjust and go up and down and stuff like that. So it's better to kind of look at the broad picture, write down all of your numbers and stuff like that you're getting, see what your graph and your trend overall is. And if it is trending downward, then you're on the right track. Keep doing what you're doing. If it's not, and if it's trending upwards, then you're overeating and overconsuming. So adjust and fix where the issue is in your dietary patterns until you start seeing the trend going downwards. Then you're on the right track. If it flattens out, you've more or less reached weight maintenance or whatever. So yeah, a lot of things you're going to think about. I know 13 pounds seems like a lot, but when dropping calories, isn't water weight coming off first? Yeah, and absolutely, water weight will come off initially, depending on, well, not only water weight, but just if you're eating such a low calorie amount and you're at a higher calorie amount, certainly there can be a large amount of weight that comes off in terms of water, in terms of food that you're putting in, that sort of thing. But generally, that's going to be in the range of, 5 pounds maybe ish, and that's on the higher end of things. If you have a significant amount of muscle mass, so I have more muscle mass than the average guy, my height and everything like that, and I can see water weight fluctuations when I'm like fully depleted to when I'm fully loaded with carbs, anywhere from 7 to 8 pounds, and that's big fluctuations and shifts in water. So yeah, it can definitely play a role in stuff. But even if we took out, say, 5 pounds, that's still 8 pounds in 20 days. That's still a lot of weight. Generally, I would aim for 8 pounds in 8 weeks. Pound a week, slow, steady, consistent weight loss. Yeah, so that's kind of some aspects and stuff to think about there. So Carrie Ann, Dr. Dan, are you helping people privately with treating and diet protocols? Yeah, I sure am. You can book a consultation with me via link in my bio, or you can go to my website, healthevolved.co, and you can book a consultation with myself there, and we can see if you're a good fit for the program and coming on board and having been supporting from the dietary, exercise, all the above. Happy to help. So Humblebee, thank you. My pleasure. Cookie dough. Oh, cookie dough. How many Premier protein shakes can I have per day? It says only one, as it causes constipation. So, I mean, there's technically like you can have like as many as you'd like. There's like, you can have like multiple Premier protein shakes per day, but yes, there are potential side effects that can come with that. Constipation being one of them, because you're getting a crap ton of protein. I mean, 3 shakes, you're already at over 100 grams of protein in a day, which is a good thing. But at the same time, yeah, you're going to potentially lead to getting bunged up and stuff like that. B, you also need other nutrients and macronutrients in your diet. So whether that's carbohydrates, vegetables, fats, all those sorts of things, for proper digestion and proper overall health and stuff like that. So need to keep those aspects in mind. Generally, if someone's having 2 a day, that's 2 a day. If maybe they're on, say, one of these medications and can't eat a lot, and so we're trying to build their protein, maybe we'll start with that. But we have the plan of keeping it to maybe 1 a day and trying to incorporate more whole foods and getting a greater breakdown on, overall what an individual is eating, and just getting more of those other nutrients that they ultimately need and need to consume and stuff. So that's some of the aspects and things to think about in that aspect. And then as well, whenever we're looking at liquid calories, Like they're great on the go. Don't get me wrong. I have a protein shake every day, but it is not nearly as filling as whole food. So having, chicken, edamame beans, whatever your cup of tea might be, it's not going to be as filling as those. So that's another thing to kind of keep in mind. But if you're in a pinch or whatever, yeah, you can definitely use it for sure. Ozempic stopped the food noise in my head. Yes, that definitely is something that that's what they're awesome and good for. Kugido, my Ozempic pen has a bubble. Can I still inject it? So yeah, all these pens, if I got another one here. I don't know if this one has technically a bubble or not, but this is a Saxenda pen. But sometimes you will see a bubble in like the glass area there. There's nothing wrong with that. That's totally okay. It's just a bubble. And whenever you inject it or point it down, the bubbles are going to float up away from the liquid and stuff like that. So no worries, no concerns. You would be more concerned if there was like white cloudy stuff or any chunks or anything like that that'd be floating around. But a bubble is no issue, no concern. Lucy Poo, best app to track calories and protein intake. I would say the best free app is MyFitnessPal. There's a large number of like paid apps and stuff. I think Chrono Nutrition might also be free as well up to a certain point. One thing I don't like about Chrono Nutrition is it gets way too into like all this detail of all these ridiculous macronutrients and just throws a whole bunch of information at you that you ultimately do not need. So that's that one. There are other apps and stuff like, full-on coaching apps and that sort of thing that can certainly help. But I would say MyFitnessPal is kind of probably one of the more easier ones and certainly the more comprehensive, if you will. The one aspect that I often tell people is like not to get too caught up in like, if you're tracking your food, for example, and it's like you had a chicken breast for dinner. Well, when you type in chicken breast, you're going to get like 50 different other chicken breasts that are in there. Pick one or just pick just general chicken breast. It doesn't have to be the Lilydale organic, blah, blah, blah. Chicken breast is a chicken breast. For the most part, a piece of bread is a piece of bread, right? So yeah, trying to get too caught up into those details and just to make it as easy as possible. And you can make like your own recipes and meals and customization and just kind of plunk things in once you kind of have a regular routine with it and your regular meals and stuff that you're eating. So I'm all about just making it as easy as possible, but those are kind of the best right now, other than just tracking it by hand or something like that. Skimp, do you think Mounjaro is more effective than Ozempic for weight loss? So if we look at purely on a data aspect of it, Ozempic does, or not Ozempic, but Mounjaro, if we look at the data in the trials, Mounjaro does lead to a greater amount of weight loss compared to Ozempic and Wegovy. So yes, in that sense it does, but it's really going to come down to the individual. And ultimately how they are, other comorbidities, other things that we need to think about. One might be better than the other, one might respond better, that sort of thing. With a lot of things to kind of take into account. But overall, on a purely weight loss number basis, Mounjaro seems to be more effective. I haven't got a whole lot of experience with it in my clinical practice. Mounjaro is approved here in Canada, but we currently don't have access to it. Maybe March, maybe April. I don't know. It's tough to say. The goalpost keeps changing and waiting to hear from the various drug reps and stuff. So I wish, Hudson, I wish more people would talk about the food noise and mental aspect of Ozempic. I definitely agree. That's certainly something that we could certainly could make some more posts about, and kind of certainly talk about it a little bit more because it's important and it's certainly something that a lot of people bring up and talk about. Yeah. Wish_horse low audio level. Have you tried turning up your audio? Jetto, what about olanzapine? In what sense? Weight gain, effectiveness? What do you want to know? Olanzapine definitely is more of a weight promoting medication. It's also very good at what it does and the conditions that it manages and stuff like that from a mental health perspective. So it's kind of a balancing act. There are other agents that are less weight promoting, especially with some of the newer antipsychotics that are on the market, such as Rexulti, and there's a brand new one that just came to market. Has a very interesting mechanism of action that is not weight, doesn't promote weight loss, but is more weight neutral for sure. So yeah, well, I guess it kind of depends what more you'd like. Joyful Joy. Joyful Joy uses eye track with Lose It. I have never heard of Lose It before. Interesting. I'll have to look into that. So Lose It might be another app or something like that to help track calories and protein. So as a fly. David Boys, I'm on Rybelsus and have lost 30 pounds, hoping to get down to normal weight by the end of year. Awesome. I'm glad the Rybelsus is working for you there, David. I'm always kind of fascinated by the conversation around what is normal weight, what is healthy weight. And if we use like the BMI and stuff like that, I'm not against the BMI. It is a good screening tool and used for epidemiology and population statistics and studies and stuff. But there's a lot to take into account in terms of what a healthy BMI is, or healthy weight is, I guess you could say. Using myself as an example, I'm sitting at about 200 pounds right now. I'm 5'10", and based on that, I'm overweight, and I'm like almost up to what would be considered the obesity category, or class 1 obesity in terms of BMI. But I'm at a very healthy weight. I just carry a heck of a lot more muscle than the average guy that's my height and stuff. So it's always kind of finding what is a normal weight, but ultimately what is your best weight, which is the weight that you can maintain long term, that you are able to feel healthy and feel good, and you aren't losing your mind trying to maintain and to keep yourself at and stuff like that. So yeah, that was kind of a random tangent, but there you go. Nurse Jones, I started Wegovy 2 weeks ago. First week was fantastic. I lost 5 pounds. This week, my appetite is back. So yeah, your appetite is likely coming back because you're hungry, you've lost some weight, your calories have been down and stuff like that, so your body's not used to it. And the first week, likely that 5 pounds was likely that shift in water weight we were kind of talking about earlier. Ultimately, you know, we clean up our diet and we kind of become more stringent and lower our calories. Yeah, we see an initial weight loss and whatnot. But I'd be looking at how restrictive you are and what your calorie intake ultimately is. And are you getting getting enough calories in and enough protein to properly nourish your body and stuff? I mean, 5 pounds, yes, is exciting, but we also need to think about sustainability and ultimately keeping that weight off in the long term. So looking at those aspects, and that can certainly help the hunger as well. You're only on week 2. It's going to take 3-4 weeks for you to really start noticing the effects. And then even then, it might take a higher dose of Wegovy to really start noticing to kick in. I'm on Ozempic for 6 months. My doctor has now put me on metformin. Okay, cool. So I mean, metformin, I'm a big fan of metformin. Like, metformin has a plethora of benefits, and we keep studying it and finding out more crap that it can do and stuff. It has the protective effects in terms of helping to protect our heart. It also is very effective at managing our blood sugars, and it can certainly potentially help or support weight loss efforts and stuff like that. But yeah, it's mostly used for blood sugar management, but it's a great addition. Not so much for individuals that have obesity, but certainly for people that have diabetes or blood sugar issues. It's certainly something that we look at adding on. Amadi, do I still need to count calories with IF 16 and 8? I mean, you need to know kind of what your calorie intake is during your feeding window, because again, intermittent fasting isn't anything special. It doesn't promote extra weight loss or anything. And if you overconsume, so you consume more calories than what you're burning in your feeding window of your 16 and 8, then you're going to gain weight. If you consume equal amount of calories in versus calories out in your feeding area in a 24-hour period, your weight's going to stay the same. If it's less than what you are consuming during that feeding window, then you'll lose weight. So that's kind of what you need to look at and know roughly what your calorie intake is. A lot of people will naturally, once they kind of restrict their feeding window, consume less food. And that's kind of the idea behind it, is that it just shortens your window for what you're consuming that food in. I found a lot of people, eventually it does backfire though, because, well, in my opinion, fasting just sucks and I get cranky. But also, again, biology eventually takes over and says, cool your fasting and stuff like that. But we're hungry and we need nutrients. And so we're going to get you to eat. It's going to get you to eat. So yeah, a lot of things to kind of consider there. And yeah, that kind of hopefully answers your question. 1,200 calories per day. And my loss has went way down. I weigh foods and count. What's wrong? I also fast for 17 hours. Can't get GLP-1 meds, trying to get down from sleep apnea. So are you talking about like how quickly you're losing weight? Because I mean, 1,200 calories, and Jake, I'm assuming you're male, is way too low amounts of calories, and basically you're chewing through everything from fat to muscle tissue to eventually hunger and biology is going to kick in and get you to eat. But in terms of how quickly you lose weight, I mean, initially, yes, we lose weight quickly, but eventually that weight loss is going to slow because you're physically smaller. Your body becomes more fuel efficient in how it uses the calories that you're putting into it. And overall, your metabolic rate, if you are chronically in a calorie deficit and losing weight, is eventually going to metabolically adapt and just reduce how many calories your body burns by just simply sitting or laying in bed or whatever. It's like that. So a lot of things to look at. But yeah, if you're male, I definitely wouldn't have your calories anywhere near that. I would probably have your calories up much higher and be focusing on things like resistance training, weight training, and yeah, those other components and stuff. Gucci, is there any advice you can give regarding Mounjaro not really helping? Does it not work for some? So it depends on what we're kind of distinguishing as not working. If it's decreasing your appetite and that sort of thing, then the drug's doing what it's supposed to do in decreasing your wanting and food seeking behaviors and stuff. If you're getting that, and if you're not losing weight in that same breath, essentially you're not in a calorie deficit. So looking at what your dietary patterns are, what your activity levels are, those all need to be adjusted and taken into account to ultimately lead to weight loss. If you're on the drug and at the top dose and you're not noticing any decrease in appetite and that sort of thing, it just might be that, the medication doesn't necessarily work for you or that sort of thing. And certainly switching to another one might be an option or something to think about. But yeah, it really kind of depends on what we're looking at as not working, if you will. So hope that helps. Stephanie Land, thinking about a supervised fast, but worried about muscle loss. Anything to consider? I've gained muscle through resistance training since August, lost 35 pounds, April to July with August. So my question would be, what is the fast ultimately going to do for you? Yeah, you're going to chew through your muscle mass, and intermittent fasting has been shown to lead to a greater amount of muscle loss compared to, just general calorie restriction diets and stuff like that. So yeah, it'd really be a question of like, why are we doing the fast? What is the goal with the fast? And if you're gaining muscle and still losing and stuff like that, keep plugging away with what you're doing. Like, that's going to be the ultimate game changer for you. Maintained since July at about 215, down from 250, but have gained muscle. Would like to get under 200 if possible, 5'2". So yeah, so if you're gaining muscle and stuff like that, that's awesome. That's fantastic. And I would even look at, before you do a fast or anything like that, as I kind of tell everybody, like, if you're looking to kind of change something or do something else, the best thing you can probably do is to like take a diet break. So take a break from, you know, dieting chronically, take a break from that whole aspect, bring your calories up to your maintenance level and hold yourself there for a couple of months, make a real focus around health and that sort of thing. And just kind of give your body a break from this aspect of constantly dieting and trying to lose weight, and then give another kick at the can, you know, in a few months after you've done that for a while. Not only from a psychological perspective does it help, but it helps from the metabolic aspect. And you might even be able to build more muscle in that period of time and ultimately make that journey to 200 a little bit easier. However, you know, if you're continuing to build muscle and that sort of thing, and, you know, you're not able to reach that 215, it's also taking into account, well, you know, what is losing or getting to 200 pounds going to do for us, right? It's always asking that question of why are we doing this? And if it's for 10, 15 more pounds, what exactly does that mean? Does that mean, you know, we think we're going to be, you know, a change in our mindset, our health, all that sort of thing? Or is it just more, that's been the target weight that we want to reach, or was a weight that we were at years and years ago? So really distilling down what that actually means. And if, you know, you only get to 210 pounds, but you're jacked and got a whole lot more muscle, well, you're winning. Like, you put on 10 pounds of muscle, fantastic, awesome. Like, just looking and just making sure that the goal and why you're doing what you're doing is clear as possible. So always something I recommend. Cookie dough, when I inject twice, should I do one on each side or both on the same side of the abdomen? As long as they're spaced by a couple of inches, it really honestly doesn't matter. You can inject on the same side, you can do different sides, but you also want to make sure that you're just rotating your sites week to week and that sort of thing. So I have hypothyroidism and Hashimoto's. Can I take Ozempic or Mounjaro? Yeah, as long as there's no other conditions and you haven't had a history yourself or family history of medullary thyroid carcinoma or a condition called MENS2, multiple endocrine neoplasia 2, I believe is what it is. As long as you haven't had a history of those, yeah, it shouldn't be any issue, but follow up with your doctor. Do you have a washout period of the meds before pregnancy? Generally, yes. So a drug like Saxenda, the half-life is considerably shorter. So the half-life is 24 hours. That's why we inject it once a day. So that drug, Saxenda, will be cleared out of your system within a week. Ozempic, Mounjaro, Trulicity, all the ones that are once weekly, basically their half-life is an entire week. I think Trulicity is like 5 days or something like that. But that's why we dose them once a week. However, with that long half-life is going to take a longer period of time before the drug clears your system. So Ozempic, it's going to take anywhere minimum of 3 weeks. 5 weeks is going to be more so, it's going to be cleared from your system entirely. So yeah, definitely want to have it cleared, just because we don't know how these drugs act in terms of pregnancy and stuff like that. I've certainly read case reports and have anecdotal people tell me that they had no problems. Either A, they were on the medication and then became pregnant, they immediately stopped, or what have you. So yeah, we just don't have enough data to recommend the use. And we know it crosses the placenta and all those sorts of things. So lots of things to kind of look at and consider. Karen Boomer, I'm 76. I'm going to the doctor, try to get on Ozempic for weight loss. I'm obese. Is it safe? Yeah, there's no concerns, no issues with it. If you want more on the safety and stuff like that, I've done a ton of videos on my YouTube channel, Dr. Dan, Weight Loss via Habit Mastery. You can check out my channel there. And yeah, it's I've got all the safety stuff, but yeah, it would be no concern as long as there's no other issues and stuff. No questions there. Saxenda or Ozempic is best for weight loss. Again, it's going to really depend on the individual. Like some people, Saxenda might work like a hot dang. It's once daily, that sort of thing. Ozempic is once weekly. So it depends on the individual. If we look at just purely from a data perspective, Ozempic and Wegovy definitely are the more potent agents compared to Saxenda. Saxenda led to a weight loss of about 6 to 10%, kind of depending on the individual, whereas Wegovy at the top dose, 1/3 of individuals lost 15% of their baseline weight, and certainly most people lost greater than 10% of their baseline weight. So it is more effective and more potent from just a purely data perspective. But I've seen some people do awesome on Saxenda and some people do fantastic on Ozempic or Wegovy. So it really depends. King Louis Bully, recently had my blood work checked and my liver enzymes were elevated. So, yeah, I mean, your liver enzymes can be elevated for like a number of different reasons. If you had alcohol the night before or what have you, if they're slightly elevated and kind of more in a chronic pattern, like we do a couple of consecutive tests a couple of weeks apart or whatever, and we see that they're slightly elevated or slightly above the upper limit of normal, that may be an indication that we have non-alcoholic fatty liver disease. So basically there's fat infiltrating the liver and the liver is getting pissed off about it. Now, short term, it's not really an issue, but long term, having a continually pissed off and inflamed liver can certainly lead to more damage and can cause scarring and ultimately lead to cirrhosis and may very well lead to requiring like a liver transplant or something like that. And now that we've cured Hep C, essentially, liver disease and liver failure due to fatty liver is going to be the next trigger for needing a liver transplant and stuff like that, and leading cause of liver death in the very near future here. So yeah, it can be concerning. The good news is that, losing like 3% of your baseline weight or whatever your weight is now, a lot of that weight will ultimately come from your visceral fat or the fat that's in around your organs and in your liver and stuff. And so can have quite a dramatic effect right out the gate in terms of reducing that inflammation and helping to make your liver less angry and stuff. So it's relatively easy as well. Doing resistance training without losing any weight has actually been shown to help reduce liver fat as well. So a couple of things to definitely look at, but certainly, yeah, something to kind of monitor and keep an eye on because it can lead to different complications down the road. And yeah, something you want to keep following up with your doctor on. Tips. So Aaron, tips for people who eat less calories than burned, exercise, and don't lose. Docs assume I'm lying, waiting for thyroid testing. So, kind of the theme of my advice today is take a break. Take a break from dieting. You got your whole life here to kind of figure things out and work on managing your weight. And it's going to be a lifelong management overall. It's not just something you do for a period, you lose the weight and you keep the weight off forever. Just not the way that it works. So yeah, I would just take a break, figure out what your maintenance level is, hit your protein targets and stuff like that, and then eat at your maintenance for a period of time and see how you do there and build some muscle and stuff, and kind of take the focus off trying to lose weight and whatnot and go from there. And yeah, you're probably going to be healthier overall for it, and certainly even if the thyroid thing comes back and it's whatever, we can correct the thyroid aspect and that'll help, but the weight won't come off immediately or anything. It'll still be the same process. So take a break, kick at the can later on. Again, my website, healthevolve.co/TDE. You can find the calculator there, select improve health, and we'll tell you how many calories, how much protein to eat. And yeah, that'll kind of give you some indication. Can I use Saxenda at night? Yeah, there's no problem with that. Sometimes we do have people inject it at night, and that helps to mitigate the side effects and stuff that they get. So Saxenda, after you inject it, it peaks in the system after about 3 or 4 hours, and that's when you're going to get your most side effects in terms of nausea, heartburn, and that sort of thing. So if you inject it at nighttime, it can certainly help to mitigate those side effects, and ultimately you'll sleep through them, hopefully. Vidya, hello. My husband is very insensitive. I can't lose 2 medications and many conditions. Any suggestions? Take a break. Protein, maintenance level of calories, resistance training, become more active, make health your number one focus and priority. And then, yeah, take another kick at the can, but take a break from it. Like we put all of this stress and pressure on ourselves that we need to lose weight and lose weight immediately. But we also need to like think about all of the health behaviors and things that we're engaging in and doing, because those are going to ultimately help these medications and ultimately help us to live a healthier life beyond the weight loss aspect. So taking a break, taking the whole diet aspect out of it, focus on just eating at your maintenance level of calories and properly nourishing your body and getting more activity in and stuff, and ultimately building some good solid habits when you're not dieting and starving all the time, is going to be much more effective. And then when you start to work towards losing weight, it's going to be ultimately a lot easier for you because you've built all these great habits. You know how to properly nourish your body. You probably have a good routine built around activity levels. You might even be more in tune with your body and your energy levels and that sort of thing, and knowing, hey, I need to eat more food. And so having a better understanding of that. So yeah, that's kind of what I would look at there. Davey B, 332 pounds down. 30, wow, that's a lot of weight. 332 pounds, down 31 pounds. Okay, I thought you're down 332 pounds. It's like, holy cow. But 31 pounds on metformin, might be moved to Ozempic. Will this have a major difference? Really tough to say. I mean, you've got some good weight loss with metformin. It might further potentiate and lead to further weight loss for you. But again, it depends on dietary patterns, activity levels, all the other kind of wonderful, great things and stuff that we've been talking about. So it may or may not lead to a major difference. Really going to depend on you and that sort of thing. So possibly not, but tweak, modify, and kind of take it from there. Marcia, Angela, agree. Me as well. I agree with whatever I said previously. Mrs. Shep, heart, awesome, love it, cool. 8:28, I love it. It's pretty spot on. I've been talking for like a solid hour. This whole like chatting and doing this, it's very draining for someone who's like naturally an introvert, and being extroverted, it takes a lot out of me. Like, yeah, I was peppy before we started this talk, but I can feel it. I need some food and I need to go to bed. So if that is all the questions for tonight, you beautiful people, I am going to, okay, one more question. Is weight training better than cardio if I like each equally? If I had to choose just one kind of activity for a client, a patient, or pretty much anybody to do, I only had one to choose, I would say weightlifting. Resistance training, hands down, for a couple of reasons. Number one, weight training is going to help you to build muscle. Muscle is going to have all kinds of overall benefits for just general health, well-being, as well. As we age, we tend to become more frail, and our muscle mass begins to deteriorate and that sort of thing. So lifting weights helps us to maintain that, helps us to maintain stronger joints, helps us to avoid things like needing knee replacements and having falls and breaking bones and all those sorts of things. It helps to strengthen our bones. Like the list that weightlifting has, it just goes on and on and on and on. Further, it helps with weight loss because it helps preserve lean muscle tissue. And out of anything that you want to see quick results with, weightlifting, like week to week, you can see gains in your strength, and you will see the quick results in terms of just your muscles becoming stronger, more defined, all those sorts of things. So yeah, the weight loss, the weightlifting is always what I recommend. It also builds confidence. Like when you start moving weights around and you're like, holy crap, I just lifted up this weight, or I was here and I went to here. Like it's huge. It's amazing what it does for people and stuff. So weightlifting, cardio is fantastic. I'm not saying don't do it, but weightlifting, you can hit all the birds, all the stones. Raymond, 45R, criteria for Ozempic coverage in my area. Is metformin and glycoside how long? I don't quite know what you mean by that. It depends. Usually most of them are at least 6 months on each of them, and then they'll be able to cover Ozempic for you, but depends on the criteria and stuff. Yeah, as Liz is saying, Wednesday, 7:30 p.m. Mountain Standard Time. We are here live every week. And D, the final question. I've had gastric bypass and have low blood sugar. Will Ozempic be dangerous for me to take? Tough to say. If we don't know what the reason for the low or hypoglycemic or low blood sugar is, it potentially could be. Yeah, there's a lot of factors and stuff to take into that. I can't really say for sure or anything like that as to whether it would be. It would really depend on what's driving it, how often it's happening, and all of that sort of things. So lots to look at there. Okay, last one. Nicole, have you heard of someone having pancreatitis and continue on Ozempic? Yes and no. I mean, I've had colleagues say that they think possibly a patient had pancreatitis due to Ozempic, but most people, we don't continue on after that. We tend to take them off the medication, just because if it did indeed cause the pancreatitis and there was no other extenuating factors such as, they had gallstones, which often happens if you lose weight rapidly, which can certainly happen with these medications. Gallstones can piss off your pancreas, lead to pancreatitis. If they were consuming alcohol, their triglycerides are high. There's all kinds of other things that can ultimately affect and cause pancreatitis. So if someone was on one of these drugs, had pancreatitis, if there was no underpinning cause of it, that sort of thing, that we could identify, then yeah, we would take them off of it. But if it was some other reason that they developed pancreatitis, then yes, we might continue on with it and stuff. But the pancreatitis also happens so infrequently, and usually there's an extenuating circumstance. Even having diabetes and high blood sugars can lead to pancreatitis. So lots of confounding variables and stuff there. And whether they continue on is really going to be between them and their physician. Cookie, hi, just found you. I started Wegovy this weekend. I'm excited and nervous. Take it slow. Take it easy. Yeah, check out all my YouTube videos. I have all the deets on managing side effects and stuff like that. And my website, check it out again, healthyvolve.co/TDE calculator. You can punch in and figure out how many calories you should be eating, how much protein you should be eating, plus a whole bunch more information. You can sign up for my newsletter and all those great things. And of course, check me out on my other channels at the official Dr. Dan. We're on the gram, obviously the Tickety Talk, the YouTube, the Facebook somewhat. And yeah, so I think we're going to wrap it up for there, everybody. Thanks again for everybody that tuned in. We will, of course, be back next Wednesday at 7:30 p.m. Mountain Standard Time. And yeah, great questions as always. I hope everybody has a great night. Thanks a lot, guys.